I'll be with you in one moment. I am just opening up your file. Okay. So, from what I can see, you're worried about some sort of trauma to the eye. Okay. And when did the symptoms start? Okay. Right. And any other medical problems in the last 6 months? Okay. And any serious health issues in the family at all? No, good. Alright, who do we have as your emergency contact? Okay, what's their number? Okay. Okay. When was the last time you had a general health check with us? Okay, so no one's had a look at your eye in the last 6 months or so? It's fine. Okay. Right, I'm going to have an initial look, alright? So in a moment I'm going to just ask you to swivel your chair around and stand up for me, okay? We're going to work off of that chart over there. My colleague Dr. Starling is going to see you next, alright? And she's going to give you a more detailed orbital exam to really pick out some of those underlying issues if there are any, okay? Alright. Okay, so she'll be along shortly, so for now, if you could just turn around and stand in front of the chart, that would be great. Alright, I'll be with you in a moment. Okay, I'm just having a quick look at the eyes. Looks good from here, alright. I'm going to do more of a physical test to your eyes, okay. I'm just going to be checking the general physical health, and then Dr. Starling is going to see you for a more detailed vision test, okay. So I'm going to start with a basic sight test just to make sure that there aren't any immediate concerns with your vision, okay, and then I'm going to move on to the more specific tests that I've got planned for you. Okay, if you're in any discomfort at any point, just let me know, alright? Okay, so I'm going to start off with a instrument here that's going to just block off one of your eyes, okay, and then you should be able to focus on the wall behind a little bit better, okay. So just making sure that's in the right place. Okay, so just looking at the chart behind me, if you could tell me from the top what the letters are. Okay, that's great. Good. Good. Okay. Perfect. Yep, and And is the green or the red line more prominent? Okay. That's great. Alright, I'm just going to switch this round now. Okay. So we're just doing the same thing again at the chart behind. And if you could just start from the top. That's great. Okay, next line. Yep. Good. And then the green or the red line. Okay, yeah. Alright, that was good. Just want to see if there's any discrepancies between the two. Okay, sorry it's a little bit warm in here today. Our air conditioning isn't working so well. Alright, so just focusing on the back wall, alright? We're going to go through it from the top again. So, if you could start at the top for me. Yep. Yep. Good. 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 Don't worry, I'm just taking a look at whether you're straining your eyes. Okay. Okay. Good. Good. Yeah, keep going. That's great. Can you do this next line? Okay. So. Okay. Okay. Yep. Yep. Okay. Alright, now that's fine. And is the green or the red line more prominent? Okay. That's good. Alright then. So, what we are going to do next, alright, is I just want to check your pupils, alright, because they're usually the best way to see if there's any kind of strange things happening with the eye or anything that's a bit unusual, okay? Right, so looking at my nose to begin with, alright. That's great. Just a little bit closer. Okay, and if you could just focus on a spot beyond me, okay? If I do become in the way of the spot that you're looking at, just please try and hold your focus, okay? Okay. That's great. Keep holding that focus for me. Doing really well. Okay, that's great. That's wonderful, thank you. And then just keeping on to that focus, I'm just checking how the pupil responds. Okay, just keeping that distant focus. Okay. That's great. Okay, and now just looking into the distance, okay? Okay, that's great, thank you. So I'm just doing the same for this eye, and just seeing how the pupil responds. Okay, and that looks lovely and healthy. Okay, just look at my finger. Let's try this. Just keeping the focus on my finger. Okay. Alright, I'm just trying to get the eye to do a couple of things here. Seeing how it responds. Okay. That looks good. Okay, right, what I'd like you to do now is just look directly at me, okay, and I'm going to ask you to close this eye, alright? Now I'm just going to test your visual fields, okay, so looking at me, alright, make sure this eye is closed, and I'm going to hold a series of fingers up. I'd like you to tell me what numbers those are, okay? Good, doing really well. Okay, that's great. Okay, let's try some ones further out. That's great. Okay. Alright, and let's do the other eye now, okay? So, closing this eye, looking directly at me. Make sure you keep looking at my nose and not veering off to the side. Okay, so. Perfect. Yep, doing really well. That's great. Okay. Okay, that all looks good. Well done. Okay then. Right. I would just like to now measure the positioning of your eye. Okay. So the reason why we do this is just to check whether the eye is protruding or if there's any pressure, any inflammation at all, okay? So I'm just going to ask you to sit nice and still, alright? And I've just got this instrument here that I'm going to use just to measure your eye, okay? So just doing this top one. That's great. Okay, I'm just going to press this slightly on your eye. Apologies if it's a little bit uncomfortable. Okay, let's try it this way. That's wonderful, thank you. And then let's do it this way as well. Okay, and I'm just going to look at how far it's coming out from the side. Alright, that's great. Okay. Okay. Let's make sure I've got that all right. Everything looks normal so far, okay. Okay, right, what I'm going to ask you to do now is just tip your head upside down, okay? And I'm going to get you to blow into your nose, alright? Hold your breath and blow into your nose. Almost as if you're trying to make your ears pop, okay? And then I'm going to just tell you when to come up. And don't worry, this is perfectly safe. I would just like to check how much the eye positioning changes when there's blood rushing into the area, okay? And this can sometimes be an indication of issues behind the eye, okay? So if you could just do that for me, it'll only take a few seconds, okay? That's great. Okay, just a little bit longer. Alright, just relax now. Okay, let's just check that. Okay. Right, that's absolutely normal, okay. Sometimes we will look for tumours behind the eye, but no, I'm not worried. Just one last measurement. Okay. All right. Okay, so you mentioned feeling like there was some trauma, okay, to the area. So I'm just going to use some gloves to check the bone, all right? Make sure we haven't got any fractures. If I do find anything, I will send you in for a further test, okay? Alright, so just feeling around the eyes, around the orbit, okay? Any pain at all? Okay, that's a good sign. Right. I'm just going to compare the two sides. Okay, no. There's no pain, no? Alright, does seem okay. Alright, I'm just going to check the maxilla bone. So if you don't mind, could you just open your mouth? I'm going to place my fingers inside the cheek and just feel the bone. Okay, so let's do this side first. Okay. Just going to move that slightly. Any pain? No. Okay. Alright, and on this side. Just going to use my thumbs. Any pain in there? No. Okay. Let's just get my torch. Just have a quick look. If you could just open wide, just make sure there's no visible traumas. No. Looks great. Okay. Alright, I'm just going to ask you to do a series of facial expressions if that's okay. Alright, can you do this? Alright, and surprised. Okay, and angry. Okay. If you could just clench your jaw. Any pain at all? No, okay. I'm just going to touch you on different parts of the face, alright? And I'd just like you to tell me if there's any pain or if you cannot feel anything, alright? Okay. Okay. Mhm. Mhm. Okay. Okay. Yep. I'm just feeling around your jaw. Okay, the nerves are all connected. Alright. And around the eyes. Okay, no pain there. No. Okay. Just make sure. I'm just going to check on either side. And then on this side. Okay, I'm just going to finish off with one last just check. I'm just going to look around the eye, around the bone, both eyes, bridge of the nose. Any pain there? No? Okay. And just finally, how many fingers? Good. 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 Alright. So, my prognosis is that everything looks really healthy from a structural side. Okay, now if you are experiencing some trauma, there may be some underlying issues that Dr. Starling will have a look at for you. Okay, so she's going to do a much more detailed vision test, especially looking at the function of the eyes. All right, she'll be along in a moment, so you don't need to go anywhere. If you do have any questions for me, or if you do have any pain around the bone area or any concerns at all, do get in touch, okay? You've got my email address. Okay. So I'm just making a quick note of what I have seen. Okay. Okay.